Pediatric recurrent acute mastoiditis, risk factors and insights into pathogenesis. Via Pediatric Otorhinolaryngology. S01655876.gif. Publication date, August 2018. Source: International Journal of Pediatric Otorhinolaryngology, Volume 111. Authors: Józef Mierzwiński, Justyna Tyra, Karolina Haber, Maria Drela, Anna Sinkiewicz, Michael David Puricelli. ObjectivesRecurrent acute mastoiditis is repeatedly reported in the literature, but data to understand the pathogenesis, update treatment recommendations and inform future trials are sparse due to the infrequency of the disease.MethodsA retrospective chart review from 2001 to 2016 was conducted, including 73 children treated for acute mastoiditis. A follow-up survey was attempted for each patient. Bacteriology, method of treatment, hospital course, complications, and otologic history were analyzed. A chi-squared test, Fisher's exact test and Mann-Whitney U test compared recurrent acute mastoiditis to single acute mastoiditis cases. Additionally, a comprehensive PubMed search and review of world literature addressing recurrent pediatric acute mastoiditis was performed for comparative purposes. Results among 73 children with acute mastoiditis, 8% experienced recurrent acute mastoiditis. Streptococcus pneumoniae was the only bacteria isolated in this group. History of recurrent acute otitis media, 4 per year, prior to the first episode of acute mastoiditis was identified in 24% with single episode of acute mastoiditis and 83% with recurrent mastoiditis, p0.05. Fewer intracranial, intratemporal complications were identified among recurrent mastoiditis patients, p0.05. In a group of patients treated with more extensive surgical communication during mastoidectomy for primary acute mastoiditis, wide mastoidectomy with prodetic exposure and posterior tympanotomy, no recurrence was observed. We identify multiple risk factors associated with recurrence and provide early data supporting anatomic predisposition to the development of recurrent acute mastoiditis. More aggressive opening between the mastoid cavity and middle ear may prevent recurrent acute mastoiditis episodes. Add tags, currently, ORL, medicine by Alexandros G. Sfakianakis,